Okay, I'm here with Doug Suda, and Doug is also a member of the Riverside Medical Clinic Foundation's Prostate Cancer Family Support Group.
Yeah.
So Doug, tell me about how you came to be a member here.
Well, yeah, I started out in 1999, Julie, and my PSA started to increase, and my urologist decided to do a biopsy. And of course, one of the most shocking things that can happen to you, it came back positive. So basically I had prostate cancer. And I decided to get a second opinion. So I went to another medical facility and the same results. So then it was a matter of, what are you going to do? I have a good friend of mine that went through this about 2 years before me, and he recommended that I come down here to the Riverside Medical Clinic Prostate Support Group and get some information. So I did. I attended a meeting. I was the first time I had come. It was 1999, and I picked up all the information and started to learn about all the options you have. And there are several options. I can go through them all, but basically I decided to have the surgery. So again, I went to a place where they did 300 operations a year and had the surgery. And after the surgery, then I was on follow-up for 5 years. And that meant that every 6 months I had to go in, have a PSA test, and also a digital rectal exam test. And I'm happy to announce that last February I was released. And basically I don't have to go back for any more tests.
Yay, that's great.
So just basically a PSA every year now from this point on. But I want to say this group, I did recommend to be put in the yellow book that they used to have. And that was a case where any new member coming into the group could call you. And of course, you know, they're overwhelmed with all kinds of possibilities, and geez, it just goes on and on and on. And the reason why I stay a member of this group is, and if I can give back what the group gave to me, I'm happy to do that. And also because of all the new things that come along. Because we usually have a lecturer come in at every meeting every month and talk about some of the new things that are there for treatment. And so it's interesting to see that. We had the Da Vinci robot demonstrated here, which of course that was before my time when I had my surgery, but by the same token, you know, I could see today that's less invasive as far as some of the surgeries that were done in the past. So I can't speak enough for this group. It's been very helpful for me personally, and it's also open to everybody, and you know, you can bring your significant other, your wife or girlfriend, whatever the case may be. So I can't say enough for it.
That's terrific.
It's been very helpful for me, Julie, believe me.
I'm so glad. That's really nice.
Yeah.
It's good to have a support network.
Oh yeah.
It's essential.
No doubt about that.
Great. Well, that's some good information. And anything you could give to somebody that's maybe a little reluctant or shy, who wants to come to a meeting, just some words of a pep talk kind of to...
Well, you know, I would really encourage you to come to a meeting like this. There's tons of information. It's unbelievable how much information, and it's here. It's all in one place. And you can talk to people that have gone through the same thing that you'll probably be going to in the future. So you have a good idea of, you know, what you're up against and what you can expect. And that's really the most helpful thing, you know, getting rid of the unknown that's going to happen to you. And you have various choices with this disease. You know, you have radiation, you have surgery, and on and on. And everybody has to make their own decision. You know, your doctor can't tell you, you know, what is best for you. And it's your choice depending on how you feel. In my case, I wanted the surgery. I wanted that cancer out. I didn't want it in my body anymore. So I elected to go that way, which is a rougher route to go than if you're having radiation or so forth. But you know, I want it out of my body. So it went, and I was worked out very well in my case. I was very lucky.
Great. Well, thanks, Doug, for the interview. I
You're
really
quite
appreciate
welcome.
it. It was terrific. Thanks so much.
Sure, Julie.